Autism spectrum disorder in a child. Medical history and background information. M is a 7-year-old boy diagnosed with autism spectrum disorder at the age of 2. He lives in Orlando, Florida, with his mother and father and 2 other younger siblings. The patient's physical development is within the norm. He is 43 inches tall and weighs 60 pounds. M was born prematurely at 36 weeks through an uncomplicated vaginal delivery. Around the age of 2, his parents became increasingly concerned about his lack of response to other people. Moreover, M was not eager to maintain eye contact with anyone, nor did he shift his gaze toward objects shown to him. M started primary at the age of 7 and has been receiving special early childhood education. Other than ASD, M does not suffer from any diseases or disorders save for occasional seasonal colds and flu. Developmental domains. Cognitive. Generally, cognitive skills in children with autism vary significantly on a case-to-case basis. M was medically recognized as a high-functioning individual on the autism spectrum. He is verbal even though he has certain struggles with language use and acquisition. At school, his education success depends on the level of engagement with the subject matter. So far, M has discovered his inclination to numbers and simple calculations and has shown the ability to retain information in his field of interest. Communication. M's parents made sure that their son was involved in normal situations and never felt excluded because he was different. Studies show that familial love and support help children with ASD handle their symptoms better. At the moment, M is more verbal with his parents than siblings and reacts adequately to them, especially in repeated day-to-day situations. However, when put in an unfamiliar setting, M tends to shut down and become unresponsive. Social-emotional. Children with autism might express emotions differently as compared to their neurotypical peers. M is handling his feelings relatively well, especially in social situations. However, his parents report cases of him having meltdowns with tears, which are more characteristic of younger kids. The most challenging event in the social-emotional developmental domain was MS enrollment in primary education. When confronted with new situations, the patient used to have a fight-or-flight response. He became aggressive or escaped the setting altogether. As of now, parents state that his emotional health has improved. Physical and adaptive development. M's physical development was assessed as normal. He has appropriate height and weight for his age. However, the patient displays slight delays in coordination and fine motor skills, for instance, when it comes to writing or drawing. The prognosis is somewhat positive for all the challenges. The parents report improvements due to his adaptation to the school setting. In class, M recognizes his peers, responds when talked to, and initiates contact on rare occasions. Moreover, he is less emotional about changes in daily routines, even though it still takes time for him to process such information.